Hey there, Tim Smith here. Thank you so much for being on the call. I'm super excited that you're here. We're going to be going over everything that you need to know when enrolling into Medicare. I did just want to give 1 second to the people that are still trying to get on the call, but I wanted to let you know of something. So at the end of the call, we're going to be giving away a lot of free stuff that's going to help you along the way of enrolling into Medicare and making sure that you make the right decision. So you're definitely going to want to watch this webinar all the way through so you get that free stuff that we're giving out. Other than that, let's get right into it. So I'm very goal oriented. So I've got some goals for the call. The first one is for you to get all your questions answered. You know it, I know it. Medicare is very confusing, but I want you to leave the call with a better understanding of Medicare than before you got on it. And then lastly, I want you to know that there's a lot of help out there for you. You don't have to go through Medicare alone. It's very confusing. Retirement is confusing and stressful, and you're not sure which way to go. There's help out there if you need it. That's all I want to say. So those are the goals for the call. And then I just wanted to share a little bit about my story. I don't want to be the guy that you get on here and you know nothing about. I'm just a guy on the internet. And so back in 2020, I was studying at a local university in Springfield, Missouri called Evangel University. I was playing basketball there. My wife, but at the time, was studying at Drury University and she was cheerleading. And so I was playing basketball, she was cheerleading, and you could throw a rock and hit the other campus. That's how close we were. So she was cheerleading, I was playing basketball, we were school rivals, and somehow our paths crossed. And so we met in 2019. Fast forward to January of 2020, I fully dropped out of college and pursued the insurance industry. I had a passion for it, and I saw an opportunity to make a big impact. I'm crazy. I completely dropped out. She wasn't as crazy as I was. She kept going to college, but I dropped out. And then fast forward to June of 2023, we got married. And we were always looking for something that we could build together. We could make an impact together. And so we founded Smith Insurance Solutions. And when I tell you we haven't looked back since, we haven't looked back since. We have a huge impact on social media across the country of enrolling people into Medicare and making that enrollment process so much smoother. And so we've made a massive impact on the industry, and we're just so excited that we get to help people every single day. It's what our true passion is, and we love working together and doing that. But that's a little bit about me. But now let's get into why you are here. So I'm sure if you're on this call, you've probably seen a commercial like this where you've got Joe Namath saying, "Hey, call this 1-800 number and get these extra benefits." Or maybe you've seen one of these commercials with the dynamite guy saying, "Hey, call this 1-800 number and get all these extra benefits." Or maybe you've seen one of these saying, "Hey, you can get 100 and some odd dollars back on your Social Security check every month. Call this 1-800 number." We always suggest don't believe everything that you see on TV. It's partially truth and extremely misleading simply to get you to call in. Prime example, I had a client that came to one of our webinars, just like you're doing right now. Fast forward to a couple months later, we got her on the best plan possible. Well, a couple months after that, she got a call from a 1-800 number. And they said, "Hey, we'll call her Betty. I don't want to say her real name." They said, "Hey, Betty, you can get all these extra benefits for free." She said, "No, I've got an agent named Tim. He would have told me if there was anything better." And they said, "Well, this is Betty, right?" She said, "Yes." They hung up the phone, put that yes in a signature box, and switched her plan on her to the worst possible plan in her area. And so I say all that just to say, be careful. I know you're getting a lot of calls in phone, text messages, emails, mail. I understand, but be careful who you talk to. There are a lot of bad people out there. Now, I think we've done a good job of simplifying the Medicare process, and I think you're going to see that throughout this whole presentation. And so we'll start at the very basics. So what is Medicare? Medicare is the federal healthcare system for individuals over age 65 and certain individuals with disabilities. Who is eligible for Medicare? So there is one requirement. You or your spouse must have worked a minimum of 10 years or 40 quarters according to Medicare guidelines. Now, there are these things called qualifying events. Essentially, what they are is it's a life change that allows you to get onto Medicare. And so the most common one, why you guys are all here, is you're turning 65. So when you turn 65, you are eligible to get Medicare. A couple others are coming off of disability, or sorry, drawing Social Security disability income for 2 years. You can get on a Medicare at that time. Coming off of group coverage, I understand that some of you guys on the call might have the option of working past 65. And so say that you deny Medicare at 65 and then you keep working and then you need it at 67 or 68, you can take Medicare at that time. And that's a qualifying event to get on a Medicare then. And then the last one is getting diagnosed with end-stage renal disease. If you get diagnosed with that, you can get on a Medicare at that time. So when do you enroll? We get this question a lot. So if you're already drawing Social Security, you will automatically be enrolled into Medicare Part A and Part B 3 months before you turn 65. So if you're already drawing, you don't need to do anything for that part. You're automatically going to get your Medicare card in the mail 3 months before you turn 65. Now, if you're not drawing Social Security, you actually have to manually enroll, and you can do that during your initial enrollment period. And so it's a 7-month window that Medicare says, hey, you can enroll into Medicare at this time. And that is 3 months before you turn 65, your 65th birth month, and then 3 months after you turn 65. Now, there are a few ways that you can enroll if you have to, if you're not drawing Social Security yet. The first one is you can call the Medicare hotline number and do it over the phone. Number two, you can call the Social Security hotline number and do the same. I always tell people if you value your time, you probably don't want to do those because you're probably going to be on hold for quite a while. And that's why I always suggest doing the third option, which is going onto Social Security's website and in creating yourself an account to enroll on there. Takes like 10 minutes, or you can call us. We do it for free for hundreds of people every single year. Now, I know you've heard a lot about Medicare penalties and how, hey, you've got to enroll or you're going to be penalized for the rest of your life and all this kind of stuff. It's true, but if you take a step back, there's really only two penalties that you need to make sure and avoid. The first one is what they call the Part B late enrollment penalty. And you get this penalty by enrolling into Medicare by not enrolling into Medicare during your initial enrollment period, that 7-month window that we talked about. But as long as you activate Part A and Part B during that window, you're good to go on this penalty. You will not get it. The second penalty is the Part D late enrollment penalty. And you get this penalty by not having Part D or prescription drug coverage through Medicare when your Part A and Part B effective dates are. So easiest way to solve that problem is when Part A and Part B start, you need to have a drug plan in place as well, which we will talk about. When does my Medicare begin? So we get this question a lot. So if your birthday is between the 2nd and the 31st of the month, your Medicare will actually go into effect on the 1st of your birth month. So if you were born on January 2nd, your Medicare is actually going to start January 1st. Now, if your birthday falls on the 1st of the month, your Medicare is actually going to go into effect on the 1st of the month prior to your birth month. So if your birthday was February 1st, your Medicare is actually going to start January 1st. So that's something extra that you got to remember if you were born on the 1st. Retiree group health coverage. So I'm aware that some of you guys might be working past 65 that are on the call right now. If you're planning on working past 65, there's a couple things that have to be happening in order for you to bypass Medicare at 65 and not be penalized. So two things have to be happening. One, you or your spouse have to be currently employed. Secondly, you or your spouse, whoever's working, has to have group coverage through that employer. Now, there's also one other thing. That employer has to have 20 or more employees. As long as all those things are happening, you can bypass Medicare at 65 and maybe wait till 66 or 67 when you actually retire to take Medicare. But those have to be happening. As long as you do that, you're not going to get penalized. However, if you do find yourself getting penalized, here's how they calculate it. So they're going to take the Part B premium penalty. It is a permanent penalty and is 10% for each 12-month period that you are eligible but didn't take Part B. And so you're looking at about $17 to $18 a month in penalties if you do not take it on time. Now, if you do have that option of working past 65, there's some things that you're going to want to consider because 9 times out of 10, we find that Medicare is either more competitive or it's better coverage than your group coverage you have through your employer. So here are some things that you just want to consider when looking over that. Or you can call us. We'd be more than happy to help you review it and tell you, hey, Medicare's better or your group plan's better. Options for spouses. So I always like to include this slide. So if you're planning on getting onto Medicare and maybe you cover your spouse or you cover your kids on your employer coverage, we put this slide in here just to let you know that there are options for your spouse or for your kids if they're going to be losing coverage due to you getting onto Medicare. And there's some pretty good options. The first one is the marketplace through healthcare.gov. Great option. My wife and I are on it right now. There's Christian health share programs with OneShare or MediShare. And then there's short-term medical plans with United Healthcare One or Allstate. Tons of different options. And so if you're worried about that, there are plenty of options for them. So this is what I like to call, being from Missouri, this is the meat and potatoes of the whole presentation. And this is the meat and potatoes, quite frankly, of how Medicare works. So you definitely want to make sure and pay attention to this, because if you don't understand this part, it's going to be hard to understand your options when we look over them. And so this is what you initially enroll into during that 7-month window of your initial enrollment period. So you're going to get this card in the mail before you turn 65. It's your Medicare health insurance card, and you're going to have Part A and Part B. Now, if you've ever heard anyone throw around the terms original Medicare or traditional Medicare, this is what they're talking about, Part A and Part B. Some of the costs that come with original Medicare. So Part A, your hospital coverage, typically is $0 a month, as long as you and your spouse combined for 40 quarters or 10 years worth of working. Part B, which is your medical coverage, this year is $174.70 a month for the average person. Now, if you're a higher income earner, you could actually pay more for Part B. And so you can refer to this chart here. So we're not going to be going over obviously the whole chart here, but we'll go over a few of them here. So it's important to know that Medicare looks back 2 years when determining these amounts. And so if you're getting onto Medicare in 2024, they're actually going to look at your 2022 income. When 2025 rolls around, they're going to look back at your 2023 income. They always look back 2 years every year. And so say that you're filing individually and your tax return shows less than or equal to $103,000. Well, that means you're not going to pay any adjustment. You're going to pay that standard $174.70 for Part B. Well, now let's say that your tax return shows greater than 103,000, but less than or equal to 129,000. Well, you're going to pay an extra $69.90 a month for your Part B, totaling to $244.60. Now, obviously, you can see the higher your income is, the more you're going to have to pay for Part B. Now, a lot of people get this confused. They think that since they enrolled into Part A and Part B, that they're good, there's nothing else that they have to do. Unfortunately, that couldn't be further from the truth. So Part A and Part B only cover you at 80% of what you get done. And so that is a massive risk. And on this next slide here, let's go over this example. Say that you only had Part A and Part B, and you got diagnosed with cancer and you had $1 million worth of medical bills. You would be responsible for $200,000. There is no ceiling on that 20%. Whatever that bill is, you're paying 20%. And so I never want to put this in here to scare you. I just put it in here for you guys to realize you need more than Part A and Part B. And so that's why they've made two really good options of covering that 20%. Your first option that we're going to look at here is keeping original Medicare, so Part A and Part B, and taking out a separate Medicare supplement plan and a prescription drug plan. So what is Medicare supplement? Medicare supplement is also referred to as a Medigap plan and is extra insurance that you can buy from a private health insurance company to cover the 20% that original Medicare, Part A and Part B, does not cover. So exactly like it sounds, it fills in the gaps of Part A and Part B. Now, I always joke around, Medicare likes their letters. They've got Part A, Part B, Part C, all the different letters. Well, they didn't fail us on the Medicare supplement side either. And so there's about 8 to 10 different Medicare supplement types. And they're all categorized by letters. So you've got Plan A, Plan B, Plan C, all the way to Plan N, and they all cover things differently. To make it simple, we're only going to focus on two, and they're the most popular two by far. It's Medicare Supplement Plan G and Medicare Supplement Plan N. So let's take a look first at Plan G and kind of what that would look like. So here's how it would cover certain bills. And so any bills that you get, Part A and Part B are going to pay first. So they're going to pay 80% of that bill. Then the Medicare Supplement Plan G that you pay for is going to come in and pick up the other 20% entirely. The only thing that you pay besides the premium for your supplement Plan G, the only other thing that you pay is the Part B deductible, which this year is $240. So you pay that deductible, you pay your premium every month, you have 100% coverage no matter what. Now you can also see down below here, here's the Part B excess charge of 15%. I'm sure you're wondering what does that even mean? And so the Part B excess charge, essentially, Medicare releases this big book every year of different amounts that these surgeons and doctors and hospitals are allowed to charge for certain procedures. Well, some of them are actually allowed to charge 15% more than what Medicare says that they're allowed to charge. And so if you take out a Medicare Supplement Plan G, it picks that up entirely as well. And so you don't have to worry about that. Now let's take a look at a Medicare Supplement Plan N. So here's how it would cover things. So if you took out a Medicare Supplement Plan N, all your bills, Medicare Part A and Part B, are going to pay the 80% first, just like on the Supplement Plan G. Then that Plan N is going to come in and pick up the other 20%, just like the Plan G. You're still not going to have that Part B deductible paid for, so you still have to pay that $240. So everything up to this point is identical. But what you will have to pay, the biggest difference between Plan G and Plan N is that 15% excess charge. So what that looks like is if they decide to charge that 15% on your bill, that means you're going to pay for it. That Plan N will not cover that. So that responsibility falls on you. Other than that, Plan G and Plan N are very similar other than a couple copays on Plan N. Now, here are some of the costs. So this is a male turning 65 and taking out a Plan G. This is the average national price. And so don't go screaming to everybody saying Tim lied to me. He said it was going to be $109 and it was $250. There are certain states like New York or Vermont or Florida. Some places are a little bit more expensive and can honestly be almost double. But for the average state in the United States, these are the average prices. This is a turning 65 male getting a Plan G. Here's a turning 65 female taking out a Medicare supplement plan G. And so you can see that you guys are a little bit cheaper than us for whatever reason. Maybe you're a little bit smarter, but yeah, $95 up to 179 for some of these different carriers. And I think it's important to point out that you pay this amount, whatever carrier it is, you pay that in addition to what you pay for Part B. So that 174.70. Here's a turning 65 male taking out a Medicare supplement plan in. So you can see that the plan in is a little bit cheaper than the plan G, but you have that risk of having that 15% not covered. And so, we sign up a lot of people on both options, but my favorite and the most comprehensive coverage is going to be Medicare Supplement Plan G. And here's a female turning 65 and taking out a plan in Medicare Supplement. Moving along here, some important things that you're going to want to know about Medicare supplements is all Medicare supplement plan Gs with every company pay the exact same. Same thing with the plan ins. Every plan in with all these different companies pays the exact same. So Medicare decides what these plan Gs or these plan ins cover, and then all these different insurance companies get to decide how much they charge for them. So you really want to focus on, how much is it? What's the price per month? And how much is the average rate increase? Because these companies can also decide if they raise their rates or lower their rates each year. And then all Medicare supplement plans are what they call non-network plans. And so you can go to any doctor, any facility in the country that accepts Medicare. So there's a ton of freedom with these plans. And then lastly, all Medicare supplement plans do not include prescription drug coverage. And so that leads us into our next slide. You are also going to have to get a separate prescription drug plan. And so just like it sounds, it's a separate plan that you purchase to go alongside your Medicare supplement that helps cover your drugs. Typically costs between anywhere from $0 to $15 a month. Now, if you're on some really high dollar medications, you might see that premium go up to closer to $80 or $90. But for the most part, most people will fall into the $0 to $15 range. Now, it is important to know that you may still have to pay a copay when picking up your medications. So just because you pay for the plan doesn't mean all your medications are going to be free. And I can't express this enough. It is so crucial to do your research on the drug plans because all these different drug plans cover medications differently. They have different pharmacies that are in network and out of network. So it's very important you do your research. And I want to show you something that just reiterates that. So here's a hypothetical drug plan cost breakdown. So let's just say that you did your research, you came to our webinar, we helped you enroll, whole 9 yards. Well, you take these 4 medications, but since you did your research, you're picking them up in a preferred in-network pharmacy with your plan, and the plan pays really well for your medications. Well, you're only going to pay $7.10 a month. Well, that's good. Now let's say that you kind of did your research, you kind of didn't, and you got on one that, for the most part covers medications, but you went to a standard in-network pharmacy, same 4 medications. Well, now they cost $28.60 a month. Well, now let's say that you fly by the seat of your pants, you didn't do any research, and you just kind of got on one that may cover them, may not cover them, and you went to an out-of-network pharmacy. Same 4 medications are $234 a month for the same ones that were $7 a month. So I like to put this in here just to let you know, it is so crucial to do your research on the drug part because they all cover them differently. So that is your first option of covering the 20% that Medicare Part A and Part B don't cover. And so that's your first option on the left here. Now let's take a look at your second option, which is Medicare Advantage. Now, what these plans do is they typically combine Part A and Part B with drug coverage, and they call it Medicare Advantage or Medicare Part C. So what is Medicare Advantage? Medicare Advantage is also referred to as a Part C plan and is ran by private insurance companies approved by and under contract with Medicare. Now, here's what you can kind of expect if you take one out. So instead of paying that 20%, if you take out a Medicare Advantage plan, you essentially throw that 20% away. You don't pay attention to it. What you do pay attention to is the following things. So if you take one out, you can expect to really not have any type of premium. So you're not going to pay anything to have the plan. But when you get things done, you're going to have copays for certain services. So specialist visits, hospital stays, surgeries, you get the point. If you use your plan, you're going to pay for it instead of paying for it up front. You're also going to have certain doctor and hospital networks that you have to stay within. So with the Medicare supplement, where you can go to any doctor, any facility, this one's gonna have some doctor networks that you have to stay within. However, they are moving to a national network. And so you will have coverage, but you're still gonna have to make sure that they're in network. Now, there's also going to be extra benefits built in. So you're going to have dental coverage, vision coverage, hearing coverage. Even some of them pay for over-the-counter products for you to have every month. And so it's going to have that built in. It's also going to have built-in drug coverage at no extra cost. So that's a good thing. And then they also have what they call maximum out-of-pockets. So I tell everybody, think of it like a ceiling. So if your Medicare Advantage plan you're looking at has a $3,000 max out of pocket, well, that means that's the most that you could be out from January through December. So it's a ceiling. It protects you from being out a lot of money. Now, there are a lot of rules on the Medicare Advantage side. We can't put any of the carriers on here when we're discussing copays. But here are some prime examples of some Medicare Advantage plans you would see in your area. I'm not going to go through all these, but you can see that they have different copays. These are all copays, so different copays for different things. And they do differ from plan to plan. They also have different extra benefits amounts. So some plans might give you more, some might give you less for certain things like dental, vision, hearing. And then some might have deductibles or higher maximum out of pockets. Now, let's go over this. So what are the costs of Medicare Advantage? Well, just like I said, there aren't any costs for the plan. So the only thing that you're paying out of pocket each month is what you pay for Part A and Part B. Part A typically is zero, and then Part B is that $174.70 a month, unless you're a higher income earner. Now, some important things that you're going to want to know about Medicare Advantage. Each Medicare Advantage plan has different premiums and costs for services. So you want to look at that because it seems like some Medicare Advantage plans will nickel and dime you more than others. And so you want to look at that. And then also they all cover medications differently on every Medicare Advantage plan. And so there's probably 40 or 50 different ones in your county and they all cover them differently. And so it's crucial on this part too to do your research on the drug portion. Now, there are two types of Medicare Advantage doctor networks. So the first one is what they call a PPO, a Preferred Provider Organization Network. And so what that means is it's a fancy word of saying, hey, if you go in network, you're good, you're covered. If you go out of network, you're still covered, but you're going to pay higher costs. Now, the second type of doctor network is what they call an HMO or a Health Maintenance Organization Network. What that means is you can go in network, totally fine, you're totally covered. If you go out of network, you don't have any type of coverage unless it's an emergency case. And so the PPO gives you a little bit more flexibility, but you're still going to want to stay in network as much as possible with both types. Moving along here are some of the top Medicare Advantage carriers, and some that you've probably heard of before. You've got Aetna, United Healthcare, Humana, Anthem Blue Cross Blue Shield, Cigna, and WellCare. And we do represent all of those. So that's the majority of what you need to know on the foundation of Medicare in both options. A few more slides here before we get to the bonuses and what we're giving away. Um, the 2024 Medicare Savings Program. So if you're not aware, if you're an individual or if you're married and you fall into these income requirements, and you have a checking account, savings accounts, investments, any resources under these amounts here, it might be worth looking into because you can actually get your Part B premium paid for and you can reduce your prescription costs. So if you fall under these two categories here, it might be worth looking into. You also, if you're an individual who has both Medicare and Medicaid, these dual plans are great options because what they do is they typically turn all your copays to zero for all approved services, and then they offer more benefits. So dental, vision, hearing, and grocery allowance, utility allowance, phone bill assistance, a lot of cool stuff. So if you have Medicare and Medicaid, those are both great options. Now, I just wanted to recap before we talk about what we're giving away and all the bonuses here. So, a lot of people make Medicare so much more confusing than it needs to be. There are two options, and they couldn't be more opposite. On the left side here, you've got Medicare Supplement, where you pay up front, but you don't pay anything along the way besides that deductible. And you don't have doctor networks, but you have to get the separate drug plan. Second option is Medicare Advantage. You're not going to pay up front, no premium monthly, but you're going to pay copays when you get things done or when you use your plan. You're also going to have doctor networks, but you're going to have everything included, drug coverage. You're going to have dental, vision, and hearing and over-the-counter coverage. And so both are great options. Both will help you cover the 20% that A and B doesn't cover. But there couldn't be more opposite. So that's the recap. That's what we had for you guys today. Now let's give away some bonuses. So I didn't forget, I did want to give away things because we value or we appreciate that you value our information enough to stay on the call until the end. Excuse me. So what I want to do for anyone that's still on the call, I want to give away all of our free information. And so if you're still on the call, there should be a form that pops up here in just a second. It's going to pop up on your screen. If you would fill that out and book a one-on-one call. If you book a one-on-one call, we're going to give you all this information and all this valuable content for absolutely free. So the first thing that we're going to give away is our Medicare enrollment guide. It walks you step by step of everything that you need to know. It's got a timeline on there so you don't miss any important days, all the way until you're ready and you feel comfortable enrolling into Medicare. So we're going to give you that away for free. We're also going to give our retirement planning guide away that talks about the 4 retirement roadblocks and how you need to prepare for them entering retirement. Going to give you that for free as well. And then we're going to give you a recorded version of today's call and then also a copy of the slides for absolutely no cost. And then lastly here, we're going to give you both a free Medicare consultation. So I'm going to meet with you. I'm going to go over the plans in your area and give you pricing and what all of that looks like. We'll run your doctors, your medications, your pharmacy. Make sure you have options and you're familiar with the plans in your area. And then lastly, we'll give you a free on-track retirement consultation. We've got a whole retirement division that helps people retiring with a 401k or a Roth IRA or any type of money entering retirement. If you're worried at all about outliving that benefit or losing it to the market, you will value this free on-track retirement consultation. And so all of that's free. Click on the form below and fill out your information, book a one-on-one call. And I'm so excited to see you, so excited to talk to you. Thank you guys so much for being on here. I look forward to meeting each and every one of you guys on the call. Thank you guys. God bless, and I'll talk to you soon.